Now we're going to talk about creativity and wisdom in late adulthood. So creativity. Creativity in adults is the ability to produce something novel, high in demand, and task appropriate. Creative output varies across the lifespan and across disciplines. The overall number of creative contributions tends to increase through the 30s, peak in the 40s, and then decline. However, creativity never stops, and the average age at which people have major creative contributions is increasing. Neuroimaging research supports the idea that a person is their most innovative in their 30s and 40s. It also shows that a creative person's brain works differently. It's related to the white matter, which connects the different parts of the brain. And remember, white matter decreases with age. So if creativity depends on white matter and you're losing your white matter, you're going to become less creative. So, wisdom. How would you define wisdom? Well, it tends to have 4 characteristics. Deals with important matters of life, deals with the human condition. Has superior knowledge, so superior knowledge, judgment, and advice. Knowledge with scope, depth, and balance that is applicable to specific situations. And it's well intended. It combines mind and virtue, otherwise known as character. So in this framework, you need all 4 of these characteristics in order to be considered wise. This framework means that wise people are experts in the basic issues of life. They know how to conduct life, interpret life events, and what life means. So how do we become wise? Strengths, knowledge, and understanding that is only learned by living through the earlier stages of life. That is wisdom. There is no association between wisdom and age. Just because someone is older does not mean they have more wisdom. Just because someone is young does not mean they are not wise. Instead, whether or not a person is wise is based on life experience and the required knowledge and personality. Wisdom is related to crystallized intelligence. So, factors to becoming wise. Your general personal conditions, for example, your mental ability. Do you still have all your cognitive skills? Specific expertise conditions, mentoring or practice. What do you know about your specific area of expertise? Facilitative life concepts. This is based, or like education. How much education do you have? Personal growth. This is related to Erickson's stage of generativity and his stage of integrity. And dealing with life crises. Face the problems in your life and deal with them. So these all take time. Gaining more experience, gaining more expertise, having the time to go through personal growth, having more time to face life crises and overcome them. So these factors take time, which is why we generally associate older people with being wise. Advanced age gives a person time to undergo all of this. So peer versus self-ratings. Peer ratings of wisdom are better than self-ratings, meaning people are better at recognizing wisdom in others than themselves. Mental health. Okay, depression. Only a minority of older adults have mental health problems, and most of these problems respond well to therapy. But let's talk about depression. Okay, so some symptoms. 2 clusters of symptoms that must be present for 2 weeks. Feelings and physical changes. So depression is characterized by both emotion and physical changes. The most prominent symptom is dysphoria, which is feeling sad or down. Older adults may describe these feelings as feeling helpless. Older adults are more likely to appear apathetic and expressionless, confine themselves to bed, neglect themselves, make derogatory comments about themselves. It also needs physical changes, loss of appetite, insomnia, trouble breathing. However, these may just be normal age-related physical changes and not signs of depression. That's why you need to look at the emotional and the physical changes together. So what causes depression? There are 2 main ideas, a biological, physiological idea, and a psychosocial. So the physiological idea is there's an imbalance in the neurotransmitters, probably serotonin. That's most likely the cause of severe depression. And you can have a genetic predisposition to this. In other words, your brain changes and that leads you to depression. Psychosocial causes would be how a person interprets a loss rather than the loss itself. Okay, so you have an internal belief system. It's what you tell oneself about why certain things are happening. For example, if your spouse dies and you believe that that's because you did something wrong rather than it was just something that happened. Depressed people tend to believe they are personally responsible for all the bad things that happen to them. So how do we treat depression? We often use a combination of medication and therapy. Medications usually work on the balance of neurotransmitters, especially serotonin. And then there are two major forms of psychotherapy. There's behavior therapy. This is based on the notion that depressed people experience too few rewards or reinforcements from their environment. So it's teaching them to increase the good things that happen and minimize their negative. So increasing activities increases the likelihood of something good happening. So it tries to change the behavior in order to change the depression. And then there's cognitive therapy. This is based on the notion that maladaptive behavior or cognitions about oneself are responsible for the depression, like thinking everything is your fault. A person is taught to recognize negative thoughts, such as seeing themselves as unworthy, and reevaluate and change their underlying beliefs. And this is usually the therapy of choice for older adults. This is cognitive therapy. But you'll hear a lot about CBD or CBT, cognitive behavioral therapy, which combines both of these. Okay, dementia. Dementia is a family of diseases. It's not just one disease, but they involve serious impairment of behavioral or cognitive functioning. The most famous of these is probably Alzheimer's. This is the most common form of dementia, and the fear of Alzheimer's among older adults is significant. The prevalence of Alzheimer's increases with age. It's very low in 50s, and about half of people 85 and older have it. So the symptoms of Alzheimer's include a gradual decline in memory, learning, attention, and judgment, maybe confusion as to time and place, difficulty communicating and finding the right words, decline in self-care skills, inappropriate social behavior, changes in personality. And as the disease progresses, more symptoms appear and are more regular. So maybe wandering away from home and not remembering how to get back, forgetting names and faces, including their own face or name, incontinence, loss of mobility, etc. The rate of deterioration varies, but the average is about 12 years from onset until death. So the diagnosis of Alzheimer's, the only definitive diagnosis is autopsy of the brain after death. The number and severity of symptoms can lead to a fairly accurate diagnosis of probable Alzheimer's, but the only way to diagnose it for sure right now is autopsy. So people are diagnosed with probable Alzheimer's. Screening tests exist, but attempts are made to exclude all other possible causes first. Alzheimer's is incurable and it is fatal. Like I said, about 12 years. For more information on Alzheimer's, see your book. It has more stuff. The causes of Alzheimer's and dementia, in short, we don't know. Research is focusing on finding biomarkers and genetic links. If you look at early onset Alzheimer's, which is what starts before the age of 60, it tends to run in families. And it has autosomal dominant inheritance, which means there's a presence of certain genes. That means there's a 100% chance of eventually getting the disease. So you can get screened for that, and if you have the specific combination of genes, there's a 100% chance that you will eventually get Alzheimer's. It's linked to 3 genes. If you have one, symptoms appear before age 60, sometimes in your 30s or 40s. Late onset Alzheimer's is what is after 60, and it may be linked to risk genes, essentially genes that increase your risks of getting it. Research is looking at links between genetic markers and a specific protein. There's more technical information in the book that I don't want to go into here. It's very technical, but if you are interested, please look. So how do we treat it? Currently, there's no effective treatment and no way to prevent it. Some symptoms can be alleviated, but most medications provide little relief over the long run. Behavioral and educational interventions exist, including like teaching spaced retrieval, and this is based on those implicit internal interventions that we talked about for memory. It involves teaching people to remember new information by gradually increasing time between retrieval attempts. It's just a memory aid. Interventions are focused on optimizing functioning and helping people maintain their dignity for longer. Parkinson's. This is a brain disease known primarily for motor symptoms like hand tremors, slow walking, etc. It can develop into dementia. It's caused by a deterioration of neurons in the middle brain that produce dopamine. Symptoms are treated with medication and surgery. For example, some medication increases the level of dopamine in the brain. Surgery is usually the installation of a device called a neurostimulator, which acts like a pacemaker for the brain. More research needs to be done to discover why Parkinson's can lead to cognitive impairments and how to help. CTE, chronic traumatic encephalopathy, form of dementia caused by repeated head trauma such as concussion. This is a big concern for football players, but CTE can also be caused by things like military combat. It's structural damage to parts of the brain responsible for executive functions and memory, and it can lead to dementia. So these are the more common forms or things that can lead to dementia, and a lot of research needs to be done on all of these things. So that's all I have for this section of late adulthood. If you have any questions, please post them on the forums on Blackboard.